Good afternoon. Just to introduce myself, I guess what's become my part-time job is owning and running a chain of grocery stores, ShopRite supermarkets in Philadelphia, that our specialty now is adding stores to low-access communities, low food access communities sustainably. And then what's become my full-time job, doesn't pay, but we started a nonprofit, Uplift Solutions, 3 years ago. And our idea is to take what we've learned in doing this work and to teach it to the grocers, the public sector, nonprofits, foundations, so we can all understand how we can get the biggest bang for our buck and build sustainable systems to enhance healthy food access around the country. So I'm going to first talk a little bit about our grocery business, and then you'll see the connection to this work. I guess it's been about 8 years since this has been our formal emphasis and strategy, and we have opened 5 large food access stores in Philadelphia. Matter of fact, we have a 6th one opening up near the speaker you had, opening up near where she lives. So that's exciting, and she was telling me she's ready for it. And in the process of doing this, what we discovered is we have the potential to impact people that live with modest means in a much more profound way than we ever realized. Originally, we thought it was just about getting healthy food to those people that didn't have access. But I've come to realize that we're opening a big grocery store in a low-income community. We really are the hub, the main street, the focal point of society there. And because we know it's important to have public transportation, we purposely pick locations that are rich in public transportation. And we find that our customers shop in our stores several times a week. And one of our big stores serves 25 to 30,000 households a week. So we thought, wow, we have a chance to address other issues. And we recently opened up our first credit union for people of modest means, for lack of a better word, in which no minimum balance is required, no monthly fee is assessed, and no ATM fees are assessed as a way to get off of check cashing services. And you might wonder, what does that have to do with healthy food access? Well, if a person makes $20,000 a year and they're spending $1,000 a year on cashing their check, that's $1,000 that could be used to buy healthier food. So it's really, in my mind, it's become hard to separate the issues because it's $20,000 a year. We have to get them everything that they need, and any innovation to help, prevent the waste of money helps out. The second thing is we're about to open our first health clinic in our store in Cheltenham. And just like there's a lack of access to healthy food, and there's a lack of access to reasonable financial services, we found there's a lack of access to entry-level health care. In my neighborhood, lots of doctors, a lot of my neighbors are doctors, lots of places I could go if I'm not feeling well, if I have a cold. Where I do business, not a lot of places to go. And I see my customers and employees going into emergency rooms to address their cold, and I see on the news that people wait 8 hours when they really have an emergency, and in some cases they die in emergency rooms. So the whole system doesn't make sense to me, because emergency rooms, an average visit is like $700, and in our nurse-run clinics, our average visit will be $40 or $50. So the thing that bothers me the most is when we not only we have a bad public policy that's not having a good outcome. It bothers me the most when we figured out the most expensive way. So the people who are saying that I can't be concerned about the poor because there's no money have systems that spend the most possible amount of money with a poor outcome. And I think we can fix that ourselves with relatively modest changes to public policy. So our 11th store, or our 6th urban store, will open up next year. And all of these strategies will come to bear in there, including things like community rooms, and we have community coordinators that we coordinate community activity for all the communities we serve, including we give these small micro grants. We give about $4,000 a year, because often we found as little as something under $100 could solve a pretty significant community problem, and there really is no infrastructure in society to fix a problem if it's very small. Oddly enough, when it's inexpensive and small, there's no way to get it fixed. Only way to get it fixed if it's big and we can bring a lot of resources to argue over it. So instead of complaining about it, we jump right in. One of those things is we've been actively involved the last 3 years in working with the police in buying back excess guns. And again, you're going to say, what does that have to do with food policy? It's hard to run a grocery store if people are shooting each other in my parking lot. And that's, honest to goodness, a problem I really have. And so when we see there's an uptick in homicides and gun violence, we've worked with the police to raise funds and buy back guns to make it safer for our customers and ourselves and our communities. So over the 8 years I've been doing this, we found a lot of sustainable, inexpensive ways to make this work. Matter of fact, I have 5 suburban stores and I have 5 urban stores. And the 2 of them are almost identical if you just look at the financial statements. They do about the same business and they make about the same profits after the public-private partnerships and the lower stores engineer sort of part of the solution. And what happens is, as I go to my nonprofit hat and I go around the country and show this to my grocery friends and say that, you know, you didn't have to invent the solution. All you have to do now is copy what we did. And this is a way you can grow your business. And by the way, if you have a little heart for the people, it's a great joy to help people that couldn't get help any other way. And I guess our strategy is to break down all the things that need to be done into simpler steps and deal with the people that we need to bring to the table to get those steps implemented. And we really think having a fresh food financing program with some grant dollars, some loan dollars, new market tax credits is a great tool. We are helping out wherever we can around the country to try to see that happen, because sometimes a very small gap stands in the way of having a grocery store, a brand new project with a lot of new jobs, and not having a grocery store. And when you look at the cost per person it serves, it's among one of the cheapest investments you can make. That in our case, all of our projects have been sustainable over the long haul, long after that incentive is gone. And we know it works. I mean, I think there's over 100 studies, and Policy Link, if Judith is still here, I think she did an overall study of all the studies. And we know that when you don't have access to a grocery store, there's a 17 to 20% greater incidence of obesity. And when you do have that grocery store, that's a huge fix, and that really narrows the obesity difference between the poor and the average American. And we know that it works. I mean, admittedly, we are working on things we don't know that works, but we know that this works, and it really can be solved. We've proved it can be solved. And by the way, for the business community, of which I know there's not a lot of people in the audience, but in the process of us doing the right thing for hundreds of thousands of Philadelphians, we accidentally become the market share leader in Philadelphia. And none of my competitors can compete with me, because it turns out people like to deal with someone who cares about them, who thinks about their lives and thinks about how to help them. And so I think the grocery industry will pick up on this, or you're going to see who sells groceries in this country change pretty rapidly.